So during the implantation, for transcatheter aortic valve implantation, right now the technology has evolved that much that most of the centers with a large experience decide to perform a minimal invasive approach where we don't need any more anesthesiologist, and the patient undergoes to the procedure with just local anesthesia. And that helps to streamline very much the procedure, and practically in 1 hour the device can be implanted in. Still, I think that imaging modalities play an important role because it's a very good safety net for the interventionalist, since these procedures can have sometimes complication, and a quick look on to see how the device is deployed, that there is no significant paravalvular regurgitation, there are no complications such as pericardial effusion, is key to maximize the results of the procedure. Of course, that there are patients still that will need anesthesia because, for example, the femoral access is not adequate, or because preferences of the patients. Sometimes we see patients that they are a little bit scared and prefer to be more comfortable according to their wishes. And we can do transesophageal echocardiography during the procedure while the patient is intubated. And in our center particularly, the interventionalists like to have that backup as well, because they can reduce sometimes time of fluoro, which is important as well. And we see very well how the prosthesis is deployed and how the result is. Instead, for the mitral valve interventions, their echocardiography is the leading technique, because fluoroscopy doesn't have the enough spatial resolution to show the soft tissue. So the interventionalist, although is going to use fluoroscopy particularly for the transeptal puncture, for example, or for orientation, is the imaging modality that they are used more frequently. The addition of echocardiography is pivotal, is really important. And for that, transesophageal echocardiography is the main imaging technique. We can guide the procedure very accurately. And there are solutions that you can have the fusion of imaging techniques, such as echocardiography on fluoro. And there are also new advances where, for example, for transcatheter procedures that entail the annuloplasty of the mitral valve, the combination of echocardiography and computed tomography images can help us to define better the mitral annulus and to see where the anchors of the cardioband, for example, in this case, or other annuloplasty solutions will be placed. There are not much data on that, but these developments look promising in order to get more acquainted with the use of multimodality imaging to improve the outcomes of these procedures.